Hi everyone, welcome to another episode of Psych Talk. Today I will talk about two impulse control disorders, pyromania and kleptomania. And while they may seem uncommon, they provide fascinating insight into how people can struggle with controlling specific urges. And you might have never heard of these ones, but they're very interesting and pretty rare. Okay, so let's start with pyromania. Pyromania involves an uncontrollable urge to set fires, not for personal gain, but for excitement and relief it brings. The diagnostic criteria will be repeated setting of fires on purpose, feeling tension or excitement before setting the fire, experiencing pleasure or relief after the fire is started, and the behavior isn't done for revenge, financial gain, or as a political statement. And usually it starts in adolescence or early adulthood, but it can occur at any age. And an example will be a teenager who sets small fires in trash bins, not to harm anyone, but because they feel an irresistible pull to watch flames and feel calm afterward. And obviously, without treatment, pyromania can lead to legal trouble or dangerous outcomes. And therapy that can be helpful will be cognitive behavioral therapy, which helps individuals manage these type of urges, and also family therapy can play a role if the individual is younger, but definitely it can be dangerous if it's left untreated. And I just want to make sure that you guys are not confused about, teenagers that sometimes with other peers, they set, things on fires, or they, they create small fires once every couple of years and things like that. That's not it. This has to be very frequently, and it has to have this kind of excitement before doing it, and like a peace that follow afterwards. Like there is something that they really love and enjoy about lighting up a fire and watching the fire. And it is not rare that also people who have this disorder may also be firefighters. Okay, and now let's talk about kleptomania. Kleptomania is the repeated urge to steal items, not out of need or greed, but because the act itself provides relief. So there is this sort of positive reinforcement out of stealing, even if you may be rich or you actually don't need the item, but it's just the act of stealing gives you like an excitement or enjoyment. And the diagnostic criteria will be repeatedly stealing objects that are not needed for personal use or financial gain, feeling tension before stealing, feeling pleasure or relief after the theft, and the behavior is not linked to anger, revenge, or delusions. The age range, it can begin in adolescence or early adulthood, and it may persist into adulthood. An example will be a young adult steals a keychain from a store even though they don't want it or need it, just to satisfy the urge and feel a sense of relief afterward. The prognosis, so if left untreated, kleptomania can obviously strain relationships or result in legal issues. And treatments include CBT or habit reversal training, and sometimes medications such as SSRIs to help with impulse control. And so the key differences between pyromania and kleptomania is that pyromania is focused on setting fires and the emotional relief that it brings, and kleptomania revolves around stealing items for the same sense of relief, not for their value or use. And I wanted to add that I don't know if you've watched Breaking Bad, but basically Marie from Breaking Bad, she might have had kleptomania because the fact that she often steals small unnecessary items, and she gets these excitement, and there is a relief, like an internal like a relief of internal tension. And also because her thefts are not for financial gain or revenge, but appear to be rooted in psychological struggles. So yeah, I just wanted to mention that because I thought it was pretty funny. And that is it for this episode.